All healthcare services are included in all of the covered California health plans. Hi, I'm Kevin Knaus with InsureMeKevin.com, and one of the points I wanted to drive home is that there is a critical list of healthcare services that is included with every standard benefit design plan offered through Covered California, and those same mirror plans off exchange with the carriers if you buy direct. And it doesn't make a difference whether it's a bronze or a gold or a silver or a platinum. All of those services will be covered. The difference between the metal tier plans is how much the member shoulders in the cost before they meet the maximum out of pocket. And another element to drive home is that it doesn't make a difference who the carrier is. LA Care, Sharp, Chinese Community Health Plan, Western Health Advantage, Blue Cross, Blue Shield, HealthNet, all of those core health care service benefits will be included. Your maternity, emergency services, ambulance, family planning, mental health are all in those plans. So you do not have to worry that some plan you're selecting because it has a very low price, low monthly premium, is somehow leaving something out. That is not the case in California. And Covered California has done a very good job on making sure that the standard benefit design plans include virtually almost anything that will come up in someone's life, from routine office visits to cancer treatment, as being covered, no caps. But of course, you go to Covered California and you see all these different plans, and they have different rates. And this is where you need to start prioritizing what is important to you. Now, the monthly rates are a function of the cost to the health plan and also the utilization of the health plan by its members. So if a carrier has contracts with providers, doctors, hospitals, labs that are lower cost, it will be reflected in the rate. But you can rest assured that even if it has a low rate, those core benefits will be included. Now, something that does impact the core rates is how you interact with the health plan and some of the restrictions on it. So we have the different plan types: EPO, HMO, and PPO. The EPO, Exclusive Provider Organization, allows you to see any doctor pretty much without a referral. You can just call and make an appointment. And if the doctor's in network, then it's going to be covered. With an EPO, there is no out-of-network coverage. So if you see a doctor outside the network, the plan will never cover any of those costs. With an HMO, the big thing is that you need to assign a primary care provider, and that person is kind of the gatekeeper, that doctor, to refer you to specialists in some cases. And there is no out-of-network coverage with an HMO. And not including out-of-network coverage can reduce the premiums in some of the plans. Now, with a PPO, you can go see any doctor you want. You do not need a referral from a primary care physician. And you may get coverage for some of the out-of-network expenses. But usually you have to meet at a minimum a $5,000 out-of-network deductible before the plan will consider any cost sharing of around 50%. So you don't really want to go out of the network unless it's something big, and some people do. And of course, those costs are added in. Now, another big element of the health plans that kind of drives the cost is the provider network. Now, if you have a Kaiser plan, you're going to be seeing Kaiser doctors, and they're all going to be available to you if you're referred to one of them by your primary care physician. The PPO plans generally have a larger network and will include some of those more prominent, popular medical groups, doctors, and hospitals that you won't find in some of the other plans. Your UCSF, UC Davis, Sutter, and that can kind of drive up the cost because those hospitals and providers command a higher reimbursement rate for their services. So that gets added in to the mix. But if there are certain providers, doctors that you want to continue seeing, then you have to look at that plan, those plans that include those doctors. But again, all the services are going to be covered with the health plan. One element for people when they're looking at the different plans is the customer service. And you will see on the Covered California, when you look at the different plans, will be different star ratings. And there is some scientific basis for those, some surveys. But I've also noted there's some consumer bias in there with some of these, because health insurance is complicated, and there can be issues, and so not everyone is happy with their health plan if they don't cover something they thought should be covered. But in general, all the plans do pretty good, but you may have experience with one health plan or another, and that will kind of guide you to either stay away or say, yeah, I like that health plan, I had good experience with it in the past. Another element to look at that sometimes is overlooked is the evidence of coverage or the member agreement. There can be little things in there that the evidence of coverage is how the plan operates, the exclusions and whatnot. Now again, they're all going to cover the core healthcare services, but some of them may have some other benefits. The Blue Cross EPO and Blue Shield PPO have the Blue Card program that allows you to get some routine care outside of California at kind of in-network prices if you have prior authorization. And that can be nice if that's important to you. And the evidence of coverage kind of details, the pediatric vision and dental, which is included in all of the health plans, but it's about filing claims in the network for those, and that's all included in there. And they can be a little dry to read, but if you have specific concerns, that's where you want to turn. And sometimes it can be difficult to get those evidence of coverage. I try and post them on my website so people can review them, but usually the health plan will send you the member agreement so you can comb through it. So all of that together, helps you make a decision. But what is critical is that regardless of the decision, regardless of the metal tier, regardless of the carrier, and the co-pays or the co-insurance, all of the health plans will include the same core health care services. And that's really important. You can feel safe that no matter what plan you pick, and you come down with cancer, it's going to be covered. So if you have any questions or comments, you may leave them down below. So for InsureMeKevin.com, I am Kevin Knaus.